Welcome to Stuff Not Taught in School, a series of videos about stuff not taught in school. Many of the topics are sensitive, but all are important. Thus, all ages are encouraged to view. Today, I want to speak about going against medical advice. So, your doctor told you that in order to treat your heart condition or your depression, you have to undergo a certain medical treatment. And you're concerned because maybe that treatment hasn't undergone enough testing, or maybe you're worried about potential side effects, or maybe you've been using that treatment for years and it's just not working. You might try explaining that to your doctor, but your doctor just isn't listening to you. You're not alone. Alan Roses, former vice president of genetics at GlaxoSmithKline, allegedly wrote that most prescription medications don't work. Isabella Wentz, on the topic of things not working, said that my time as a consultant pharmacist and patient advocate had made me aware of the fact that doctors, while most of the time are very well-meaning, did not know everything about my body. Many doctors like Wentz, rather than pushing for surgery or medication, push for treating conditions by repairing the gut flora, getting more exercise, improving the diet, getting more sleep. And so if you're concerned about going against medical advice, then by taking medications rather than repairing the gut flora, for instance, you're going against the medical advice of people like Wentz. I said in a former video called Sources of Advice that you might have different religious leaders or different political candidates saying different things, and the way to ascertain the veracity of their claims is to do research. The same thing is true about medical advice. To determine which medical treatments are best for you, it's best to research them, see which have studies. Which studies show that that medical treatment is better than a placebo, see which medical treatments don't have unwanted side effects. And people like Wentz provide you with bibliographies so that you can go ahead and check out those studies for yourself. And on the topic of researching studies, researching medical treatments, Dr. Jenny Byrne wrote that a sign of a bad psychiatrist is that they have a negative or even angry reaction when you look information up on the internet. I'd like to add that that's probably because the psychiatrist is afraid that the patient might find information contrary to what the psychiatrist is saying, that the psychiatrist is afraid that the patient might find the truth. I want to say what I said in the Sources of Advice video, and that's that the presence of a title does not make logic any more logical. Judge advice based upon logic.